The year 2020 is the International Year of the Nurse and Midwife, as designated by the World Health Assembly. And believe it or not, the choice was made before COVID-19. Welcome everyone, wherever you are. My name is Rawa Oje, and I will be your host for this panel, part of Wish 2020. Everyone talked about them this year. Everyone applauded them and lit candles for them. The front line, like many like to call them, the White Army. But they are not soldiers. They are leaders at the forefront. And as Her Royal Highness Princess Muna Al Hussein said in her speech in front of the World Health Assembly last week, applause without action is no longer acceptable. Recognition without rights and proper remuneration is not sufficient. Through this panel, we will talk about challenges, but also about actions to take and how we can build on this year's recognition to improve the conditions in which nurses and midwives work globally and locally. Let's welcome members of this panel. I have with me in the studio Professor Debbie White. She's Dean and Professor at University of Calgary in Qatar. And we have with us Dr. Sana Al-Harahshi, Senior Associate of Research and Policy at WISH. We have with us also Professor Ruwaida Al-Maaita at the Faculty of Nursing from Jordan University of Science and Technology. We also have Mr. Jim Campbell, Director of Health Workforce at WHO, and he's very keen on us letting everyone know that this year WHO Health Assembly awarded the General's Health Leaders Award for Outstanding Leadership in Global Health to Her Royal Highness Princess Muna Al Hussein of Jordan for her dedication and service to health and humanity and her tireless support over 6 decades for nurses and midwives. We also have with us Ms. Afra Musa Saleh Ali, the Assistant Director of Nursing at Primary Healthcare Corporation, PHCC. Feel free throughout the panel to send us your questions and to whom you would like to address it. We will try to make this conversation as interactive as possible. Each member will answer my first round of questions in 3 minutes. Then we will move to your Q&As, so make sure you send us your question as soon as it comes to your mind so we could have the time to queue it in and address it to the proper panelists. We will start with you, Dr. Sana Al-Harahshi from WISH, Research and Policy Associate of Research and Policy at WISH. Can you begin the session by giving us a brief overview of the report?
Okay. At the beginning, I would like to thank all the contributors to this report, starting with Professor Deborah White and Afra from PHCC, Mariam Al-Mutawwa, the Executive Director of Al-Rumaila Hospital, Dina Norman, the Executive Director of Nursing at Sidra. These policy briefings provide an overview of the progress in nursing and midwifery with a main workforce development with a main focus on Qatar perspective. It highlights the current evidence about nursing and midwifery contribution to health and population well-being. Nurses and midwives are at the heart of the healthcare system. They play an essential role in prevention, promoting health literacy, emergency response, and patient safety. As now the world fights the COVID-19, their contribution is immeasurable and countless. It highlights also the global and national key issues and achievements. At the global level, it highlights the contribution, it highlights the achievements in the several areas in policy, education, training, leadership, and capacity building, the job development. At the national level, it highlights also several achievements in leadership and management, partnership, education and training, and initiative undertaken. Qatar has made a lot of efforts in this area, and regardless with all the significant contribution, there are several challenges and gaps that must be highlighted, such as the absence of a fulsome work health model for a workforce model and the lack of uniformed coordinator national strategic plan for entry to practice, education and leadership capacity building. There is also a lack of uniformed and coordination between intersectoral cooperation for retention and recruitment. There are also challenges in regulation and organization issues and marketing to raise the profile of nursing. To build a strong and sustainable health workforce, there is a need of sufficient, high-skilled and empowered and motivated health workforce, including nurses and midwives. To build this strong workforce development, we need to work on the following area. To create, first, to create a long-term workforce modeling plan to inform health and the population service needs, to raise the status and the profile of nursing in order to enable them and their contribution and empower them to contribute greatly to health and meet the health needs of the population. Also, there is a need, there is a lack on coordinated intersectoral recruitment and retention. So those are the challenges, and in order to make up those and address those challenges, there is a need of action in the following areas. Create a long-term healthcare workforce model to inform population health, strengthen and increase investment in nurses and midwives, education, training, and leadership capacity building, enact and ensure that there are effective legislation, regulation, education, and employment arrangement in place to advance nursing practice, improve and promote and raise the status of the midwives and nurses.
Thank you, Dr. Al-Harahsha. We will get back to you. Professor Ruwaida Al-Maaita at the Faculty of Nursing at Jordan University of Science and Technology. What can we do better to maximize investment in strengthening nursing leadership and influencing health policy?
Thank you so much. Actually, I changed all my speech for today or my intervention. But, you know, I would like to relate for the different call for action that we have from WHO, we have also from the State of the World Nursing Report, we have from the Global Strategy on Human Resources for Health, we have from the Strategic Directions for Nursing and Midwifery, from the ICN, from the ICM, as well as, you know, the WISH report, the new WISH report. They are all actually reaffirm the need for more investment in the education jobs as well as leadership for nurses and midwives. Of course, we have to prepare, you know, better nurses, better nurse leaders for the future. I don't want to talk about, you know, the COVID-19 because I said that I'm going maybe to say other things than what I prepared before. But I would like to relate also to the State of the World Nursing Report. This is very influential and evidence-based report. This is a very strong tool that we can use. One thing that I would like to say that the report concluded that we need around 6 million new nursing jobs are needed by 2030 to address the global shortage. A simple calculation for that shows that we need to prepare more than 600,000 nurses per year. And if we, I don't think that we can start from next year. Anyhow, this is very strong evidence, the strongest actually. But during the Triad meeting last June, Professor Jim Bochan, who is a friend of Jim, warned us that the evidence alone does not change the world. So it will not change nursing, the evidence alone. He said, and I quote, "It is getting the evidence into policy dialogue and bringing power and knowledge to the political interface that is most important." So if we keep talking, we have numbers, we have data, if we don't use them in a very intelligent and smart way, we will not do anything. We will keep doing the same. Of course, this means that we need to invest more and to change the way we play it, around. So what we should do, actually, we need to be more articulate in shaping and influencing and powerful nursing profession, which entail profound changes and transformation of our education, practice, management, research, collaboration, and strategic partnerships, as well as leadership. Of course, we need to sit more and not to discuss, but also to argue. We have many questions that we need to answer also in a different approach, a new approach. We have to answer what kind of nurses we need for the future. Of course, in light of what we have, now, in light of all challenges, in light of, of the many nurses that we lose, of course, and other healthcare providers with this pandemic. And what are our plans to produce nurse leaders? What kind of leaders we're talking about? What we will do differently to prepare a critical mass of nurse leaders? For me, actually, of course, we need to cultivate more nursing leaders from the bedside to the boardroom and throughout the education system as well. So we need to look at the leadership issue from 5 or 6 eyes. The first eye is on the education system. We need nursing students who are on the seats for obtaining their nursing degrees. Must be prepared as leaders, policymakers, and health providers of the future to influence the making and the shaping of the healthcare sector. The same we have to do and to prepare our faculty members. The second eye, actually, will be on the nursing profession itself and also on the power structure of health and non-health sector. We need, actually, for efficiency and the proper gains, we need a larger pool of nurses and midwives who are policy competent, with the skills that enable them to access the power structure inside and outside the health system. We need more nurses to advance their skills from policy development to policy influence, from organizational policymaker to state legislators, from nursing to health and non-health leadership positions at all levels where critical decisions affecting patients and health security are made. The fourth eye, actually, we need to look at the legislation, we need to look at the rules and regulations we have, and we have to update them accordingly. The fifth eye is on politics also. We as nurses need to remember that the more complex the challenges and of what we have now, we learn, the more verification that health is very political. This is very true because the simplest term of politics refers to the exercise of influence. If we want to be influential, we have to know how they play politics. More also, the fifth eye is in both policy and politics together. Understanding the interplay of policy and politics in health system, we need to understand it really very well, because it is very crucial for nurses and nurse leaders in order to drive policy dialogue process and play an integral role in leading change and influencing health policy to achieve sustainable development goals as well as universal health coverage and economic growth. And also we need the seventh eye, actually, we need, this is the eye of the world on us, how we're going to respond to the all call of actions that we have from the different institutions, starting from up WHO, ICN, then down to the national level. This is very important. Today, we need to renew our commitment to continue emphasizing on the importance of creating critical mass of influential leaders. Can we do it? Yes, we can, because nursing expertise is a valued currency. With your collective and our collective voice and our partnership with WHO and others and the coordination, as well as with collective voice and power, you will definitely succeed in influencing policy to strengthen our nursing profession. We all now know that governments cannot achieve healthy nations without universal access to healthcare. This is the best and right time to make governments commit to actions and make proper investment in nursing, in influential leadership for nursing. Alone, we can do it fast. Together, we go far. Thank you.
If I were a nurse, I would vote for you and I will follow you blindly, I swear. Professor Debbie White, Dean and Professor at Calgary University here in Qatar. Following up on what Professor Maita said, there are major gaps sometimes in education program for aspiring nurses. Where are those gaps and how a university like yours works on filling them?
I think some very good points were made. I think when we talk about gaps, we have to talk about two things. Gaps in how the structure is in programs, whether it be in design and also in content. And the reason I say that is that we have, and we've had great success, I think, globally, but still need that concerted effort around competency-based curriculums. So our curriculum is both competency-based and content and concept-based. That's absolutely critical. Another thing in terms of the particular structures is you really need that collaboration that was talked about earlier, where you have innovative clinical settings, innovative technologies where appropriate, and use those appropriately. So that isn't always in place. And so that collaborative piece is absolutely critical. I think in terms of content, we really have moved pedagogically from a place of a medical model that is medicine, surgery, such. We really have to understand all those competencies from a technical and content knowledge. But really what I'm seeing in curriculum, and certainly the report, the evidence in this report and many WHO reports, it is a call to look at things like global health, population health, the burden of chronic disease. And when you look at leaders, leaders have to have that knowledge because clinical leaders have to understand that. Leaders in policy have to understand that. When you talked earlier in terms of looking at leadership, that is something that we really, really closely look at. Students, and I would say students I've taught in the US in some courses, I've taught here, and I've taught in Canada, and they tend to think that leadership is administrative. It's not. Leadership is clinical leadership, but you have to know how to use the data. And I think we are moving better. I think this has been a gap in terms of how do we use data in policy and to make those arguments. Whether you're on the unit, you want a clinical improvement, you have to have data. How's that data aligned with the goals and the strategic planning? So in our programs, even in the undergraduate, we look at leadership on many levels as teams, collaborative teams, how to manage conflict, how to present a data, a policy brief. Because it's small P's, big P's. It's small, looking at leaders at the clinical level that can actually work their way through the system. So those are huge things that I think that they need to know from a leadership perspective. The other thing that I think is absolutely critical, and I don't think there's been enough attention in many curriculums, is around health literacy and health information. And so we have, at the University of Calgary in Qatar, we have actually pulled that through in our curriculum across all 4 years of our undergraduate program. And so they look at the influence of that on health and well-being. And what they learn simultaneously is how to message at different levels. And I think that's absolutely critical for clinical leaders working with patients, working in the community, working at a policy level, working with CNOs. So that is absolutely critical. And I think that has been missing in curriculum, but absolutely important in terms of that. I think in order to make really cogent arguments, that ability to use data and data science. And I think that although that has always been at a master's level, we are gradually bringing that back in terms of digital technologies and how do we use evidence in our information systems to actually look at evidence and build new research. So I think that that has been really an important piece that we have to do. The other is how we use technology safely. And so we have integrated that into our curriculum, and how do we use best practices. So an example that I could use in our curriculum, and certainly is being used worldwide, is some of the best practice spotlight organizations that use guidelines for nurses. So in our curriculum, the students will learn, and they are integrated into our curriculum so that they can then take that evidence that typically is built on systematic reviews and then take it to practice. And so in our curriculum right now, and in fact tonight, our students are doing a presentation on best evidence here in Qatar. And we are one of the only best practice spotlight organizations in the Middle East. And so students are on the forefront in international conferences presenting this sort of thing. So the leadership that was spoken to earlier is absolutely critical, and I think we have to look at the application of that. We tended to focus a lot in an undergrad at a theoretical level. Learn the content, learn about the different types of leadership. It's more than that, it's practice it, right? Look at how you can take evidence, how you build policy, how you're at the forefront of doing those sorts of things. So that has been, I think, really huge and an important piece to consider in terms of some of the big gaps that we've experienced. As mentioned earlier, I think as far as the gaps and filling those educational gaps, making sure we have flexible programming is really critical so that we can move where the health trends are, so that courses can be moved in and out. This is a huge thing that has to be considered, and COVID has done that for us, quite frankly, with online learning. The innovation that's going on in education is remarkable. Our students are loving it. Regulatory agencies have to think about that because online has not always been perceived as being positive. That provides more flexibility for people to come into programs. So that's absolutely critical. And so that is going to take a lot of collaboration. It's going to require people at every level to get together to think of national standards, national educational standards, and there's many examples around the world. And so that takes partnership with nursing, it also with our other partners, our allied health professionals, and policymakers, cross-sectorial collaboration. So that is something that we really have to look at a lot. It is being done and very well in some places. It's something we have to keep plugging away at, though. You know, one of the questions in terms of nursing education and midwifery, we don't have a midwifery program, okay? But I did want to note, and it's the WHO in terms of what they've done, and the publication, the Framework for Action for Strengthening Midwifery Education towards Universal Care. It's an excellent piece of information if people are trying to establish a nursing workforce, that is nurse midwifery. And here in Qatar, Hamad and also Sidra are looking at these documents along with the International Confederation of Midwives to build a solid, competency-based, flexible learning for midwives. I mean, that's absolutely critical. We only have to look to a few documents to see the impact that they have in terms of changing lives of patients and families. And I would say the same for nurses. If we build the education that is based on population health, global health issues, build them in terms of leadership, policy making, so that they can stand in the room and actually articulate well in a very short period of time and look at the different evidence, then I think we will build a very, very strong workforce right at the forefront, you know, at the clinical level, right straight through. And I would say the other thing that really needs to have serious consideration, and it's in the World Nursing Report and World Health documents, organizational documents, is thinking about a chief nursing officer within the Ministry of Public Health that can oversee these national education standards, regulatory practices. I think that's absolutely critical. And it's a good place to go. It's an opportunity for young nursing leaders to aspire to another role.
Thank you, Professor White. Now to Mr. Jim Campbell, Director of Health Workforce at WHO. The COVID-19 pandemic has brought to light the critical role that nurses and midwives play in delivering care. Might you be able to provide an international overview of the workforce issues arising from managing the pandemic, maintaining essential health services, because women are still giving birth before and after pandemic, chronic disease patients are still requiring health before and after. And what about the preparation for a vaccine?
Thanks, Rawa. Indeed, essential healthcare services do continue. Just to acknowledge thanks to the colleagues who've just spoken in this year of the nurse midwife. Quite critical to recognize the role that we need to deliberate on policy, on evidence and action. Really encouraged that WISH and our colleagues in Qatar are putting this agenda on the program, but putting the agenda on the dialogue for local government decisions. It's what really is necessary. We can bring evidence together at the global level, but it needs action at the national level to carry that further forward. Indeed, we've seen around the world the impact of COVID-19 on our health and care workers. And the evidence that we have clearly is, 59% of the workforce around the world are in the nurses, and a greater percentage if we count all our midwife professional colleagues around the world as well. So 3 out of 5 of the workforce, nurses and midwives. They are indeed, as you rightly say, at the forefront of the COVID-19 response. We've been looking at all the available data from the member states reporting, from the published literature, from the news, from the media, from the journals, and we're seeing a whole series of issues that have really that we need to bring to attention. Firstly, in many countries around the world, as Roeda mentioned in her remarks, there is an existing shortage in the workforce. We don't necessarily have the workforce responsive to population needs. And on top of that, we've then had to deal with the pandemic. In the early days of the pandemic, worrying data from around the world in the number of infections amongst health and care workers, and tragically, the number of deaths. And it's any death from infection prevention control is avoidable, but the numbers that we're seeing are really, really very, very concerning. The data suggests that we're getting better the further into the pandemic we go. The first 3 months were quite a challenge for everybody. In the second quarter, better protection, better risk assessment, infections coming down, but still work to be done, and investment in the personal protective equipment is essential everywhere. The rights of health workers, the environment that they work, to be taken further forward. In addition to that, we have the burden of overwork, the stress, the anxiety, the fear that comes into the workplace. Just being part and a witness to the volume of infections, the volume of mortality has an impact on our nurses and midwives around the world as well. And so they're dealing with stress, anxiety, and additional burden. And we know that there's going to be a major increase in the mental health burden amongst populations in the next 12 to 18 months. So yet more work is coming for that. We've identified in 30 countries, at least 30 countries, health workers have been on strike. They are, through their associations, nurses and midwives, through their professional associations, their unions, actually suggesting, that these conditions that we're faced with are untenable. Applause, as you rightly acknowledged, Roa, in your opening comments, applause is wonderful, but we need also to take action. So all of these factors are meaning that our workload, of our capacity of our professional teams of healthcare workers, nurses and midwives at the forefront, is under increasing pressure. And then we're hearing excellent news and evidence around the potential of new vaccine candidates being available at the end of this year or early part of next year. And that's absolutely wonderful. The investment into R&D, the speed, the pace at which that's done whilst maintaining quality is encouraging. But let's stop and reflect what that means. 2 billion doses will need to be delivered next year. That's the ambition. If you look at that, the majority of those 2 billion doses, 75%, are in low and middle income countries if we get equitable allocation. And that's huge work ongoing to deliver equitable allocation. And these are the same countries that Roeda was telling us earlier have already got a shortage of nurses, a shortage of healthcare workers, yet we're expecting them to do a global program of vaccine delivery and immunization in addition to all their other work. So real challenges coming through as we look at this. And then I want to touch on a point that Debbie made as well, if I may, around education. We are seeing with technology the utilization of technical tools, of this interaction, this virtual interaction. But we're also seeing huge challenge to the delivery of clinical practice, the disruption to clinical practice. And so, we potentially are very concerned about losing a year's cohort of education or a year's input into our cohorts. And what is the impact of that? As Roeda said, we need to recruit 600,000 and graduate 600,000 nurses a year to have an impact. And if our education is disrupted, what are kind of things? So some real challenges that the world has to face, and therefore really encourage that Qatar is looking at their own domestic issues, the rest of the region also, and around the world. Let's turn evidence into action. Thank you.
Thank you, Jim Campbell. Ms. Afra Musa Saleh Ali, Assistant Director of Nursing at PHCC. From a primary care provider's perspective, how has the nursing workforce in Doha coped with the additional pressures of providing care within the pandemic? Ms. Afra, you need to unmute your teams.
It's a pleasure to be in this summit. Yeah, can you hear me?
Yes, we can hear you well.
Yeah.
Yes, we can hear you well.
It's a pleasure to be with you during this summit. It is an exceptional circumstances that all the health sector raise high and above any perceivable expectation globally. So the experience here in Qatar to cope with the additional pressure of providing healthcare within this pandemic, it would be similar to how others cope globally. But first, let me acknowledge that the response to the coronavirus presented a real challenge for everyone, not just the medical staff, but also for all non-medical supporting staff. However, I believe that we here in Qatar, we managed it and we planned for it very well. We learned also from it. It was a process of planning, implementing, learning and improvement. So it was like a portfolio management. It was at a national level where it involved everybody, all health sectors, to work collaboratively to evaluate the available resources and reallocated according to the priority and the management. So throughout all this challenge, our nurses played a critical and important role. So since day one, nurses have continued to perform critical duties, including assessment, triaging, swabbing. They have also supporting the quarantine duties at our ports, the airports, and quarantine facilities, homes. There was also a reallocation of nurses according to their priority to support the country in this pandemic. So as I said, nurses played a vital role also. In addition to that, they played also a vital role in supporting the patient, educating them and their families, and providing evidence-based compassionate care. So all personal efforts and medical supplies shifted here to support the emergency. And there was some change in the work practice. And we put a preventative measure in place to decrease the level of transmission of this coronavirus. And to ensure also the safety of our nurses and also our patients, some of the non-urgent services, we put it on hold. And to support also the stay-at-home guideline, the Ministry of Public Health created a hotline for all to call for instant triaging and to obtain any critical information. So this service was available 24/7 for everybody, and the nurses were the backbone for this service, along with physicians, dentists, and other healthcare workers. So nurses have quickly adapted to these pandemic changes and have done an excellent job in many high-pressure situations where normal healthcare is required together with the pandemic response. At the same time, nurses have faced many challenges, and we have to acknowledge that. So many have been torn by their responsibilities to their patient and employer and the financial need to work, yet have very real worries about also burnout and becoming infected and in turn or infecting their families. So consequently, at the beginning of the pandemic, we were supporting the nurses by providing the necessary training, and also we try to provide or support them with adequate personal protective equipment and to reduce their exposure to coronavirus through their work. Also, at a primary level, we provided a mental health support for all healthcare workers, including nurses, our nurses and midwives. And also at the national level, there was a hotline was available also to support nurses and other healthcare workers to avoid them from being, or if they felt any stress or unease or depressed. There are many other things, but this is some of the area that or some of the measures being taken to overcome this pressure or to cope with this pandemic.
Thank you, Ms. Sorry, I thought you finished.
That's it.
We will get back to you with more questions because we're running out of time. Afrah, okay, I'm very sorry. We're running out of time, so we'll pass immediately to the Q&As with Dr. Sana. You have a question. Over the last few years, Qatar has made large strides towards developing a world-class health and educational system, yet realizing the goals of a world-class healthcare system is not achievable without the appropriately skilled healthcare workers. Can you highlight some of the achievements that have been taking place in Qatar in the area of nursing and midwifery workforce in Qatar and what it needs to be done further? Dr. Sana, you need to unmute your teams.
Over the last few years, there are tremendous work have been taken place in Qatar in the area of nursing and midwifery, especially in the leadership and management, to develop good and highly skilled nurses to meet the need of the population. Qatar has invested greatly in developing the nursing and midwifery through providing program such as the Leadership Change Program in collaboration with the WHO and other local and international stakeholders to build leadership capacity building. Also, in the area of teaching and education and training, University of Calgary provide a formal education. They have a program undergraduate and master level. And besides that, education and training opportunity has been provided also by CPD, and the Qatar Council of Health Practitioners has accredited several programs in this area. In terms of partnership, there are several partnerships have been achieved here in Qatar at the local level and the global level. For example, at which we have we had partnership with HMC and other stakeholders in 2018. For example, in collaboration with HMC, we launched the Nursing Now Qatar, and it was the first in the region, along with the international campaign, in order to maximize the contribution of nurses and midwifery. Also, we partnership with HMC and other stakeholders to provide leadership courses for Qatari and international nurses. Also, we have a partnership here in Qatar with international universities and to accredit some program for nurses and midwifery. But regardless, and we have undertaken here in Qatar several initiatives and strategic plans, such as the HMC Nursing and Midwifery Strategic Plan, and PHCC, CIDRA, and even the private sector, University of Calgary. But regardless of all this progress and development, there are several challenges, which as I highlighted at the beginning of this session. What we need to do, what Qatar needs to build a strong and sustainable healthcare workforce to meet the growing needs and the changing needs of the population. There is needs an action in several areas, such as creating a long healthcare workforce planning model to inform health and the population and the service need. We need, there is a need to strengthen and increase investment in nursing and nurses and midwives education, leadership capacity building, training. There is a need to ensure that there are effective legislation and regulation, education and employment arrangement are in place to advance nursing practice. There is a need for raising the profile and to promote and improve the status of the nursing and midwifery in order to enable them and enhance their contribution. They are under-recognized, even they call them the invisible group. The year 2020, the International Year for Nurses, brought the attention and the recognition of nurses, especially in the current pandemic.
But we need to take it more into action. I'm sorry to interrupt you, Dr. Harahshe, but we're running out of time, and I have so many questions to Mr. Campbell about the shortage of workforce. I will try to combine them together. There's a question about the imbalance, actually. There's quite an imbalance in nursing workforce. You have some countries who have more nurses per 1,000 person. You have others who have less. And then you have countries relying on expat nurses to recruit them as a workforce. How did the pandemic affect recruiting them? And how can we create a more a balance globally in the nursing workforce?
Thanks, Saroa. It's quite a few complicated questions within that. Let me just quickly say, what have we seen as a result? Clearly, around the world, you're right, differences in the density and the distribution of our nursing and midwifery workforce, some with undersupply, and some with oversupply. We've been calling for many years now about the need to invest in education and employment. The title of this year's State of the World's Nursing Report very much driving that investment in education, employment, and jobs leadership analogy. We've seen around the world those countries which are dependent upon a greater number of migrant health professionals have had to make rapid changes to their procedures. We've seen countries that have been, as the demand has gone up in the COVID pandemic, actively recruiting from other jurisdictions. We've seen the Philippines, which for many, many years has been a supplier to the world of the nursing workforce, actually introduce restrictions on Philippine nurses leaving the Philippines. They had a demand locally themselves, nationally themselves. They put restrictions into place for migration. So we know that if you don't invest in education and employment, if you don't work towards your own sustainable workforce, you are going to be faced with long-term challenges that when your system is under stress, you have limited ability to cope. And this is why I'm really encouraged when we see what Qatar is doing, when we see what other countries are doing to invest in domestic education and employment and a sustainable workforce. Over.
And let's hope that from the other side, with the recognition nurses had this year, that many young people will think that it's better to become a nurse than just invest in being a YouTuber. Thank you very much, all my distinguished guests, and I'm very sorry we didn't have the time to go through all the Q&As. Thank you, Professor Maaita. Thank you, Professor Harahshe. Thank you, Afrah, and thank you, Mr. Campbell and Ms. White here with me. See you tomorrow for another panel.